We know there's still a lot of questions surrounding the expansion of Wisconsin's vaccine eligibility and the progress that we are making.
And so this morning we are going more in depth with Dr. Jeff Pothof of UW Health to help us navigate all of this. And Dr. Pothof, always is so good to see you. Thanks so much for your time this morning.
Good morning, guys.
Good morning. So let's start with the expanded rollout of the vaccine. About 2 million more people will be eligible. Do you feel like it's time to perhaps open up the vaccine sooner to more of the population? For example, when I was on the Wisconsin Center Registry on Wednesday, St. Patrick's Day in the afternoon, there were dozens of available appointments. I'm wondering what you think about the timing of the rollout and whether it's time to have people be able to get vaccinated sooner.
I think it's a good question, and we need to have a careful plan, because what we don't want is people who are high risk not able to get the vaccine because they're competing with people who are lower risk. At the same time, we don't want vaccines sitting in freezers because we haven't approved enough people to get it. Now, I think with this last approval of 2 million people, it's possible that, most people now seem to be eligible for the vaccine, and we will have a lot to work on for the next few weeks as we get caught up on this 2 million people who can get vaccinated.
Talking with Dr. Jeff Pothof of UW Health. Doctor, I'm curious now, with the numbers in much better shape, in fact, hospitalizations below 200 for the first time since I think we can remember here early in the pandemic. How soon until we stop quarantining exposures? For example, if your kid sits next to a kid who had COVID in school, your child's out for 2 weeks as an exposure, or you're missing work. How much longer are we going to continue that, given that the vaccine now is getting out there and fewer people are getting sick?
I think you might see that type of thing happen when folks are vaccinated. But, one of the reasons that we have such great numbers right now and cases are going down is for those public health measures, like quarantining people who have been exposed when they have those high risk exposures. So we wouldn't want to do away with that until we have folks vaccinated.
Dr. Pothof, as more people do get vaccinated, spring break is now coming up for a lot of families. What is your recommendation with spring break travel?
Yeah, with spring break, what I say is, for folks who are driving in a car, be careful at those rest stops. Be careful about eating at restaurants indoors on your way to where you're going, just because you don't know what the COVID situation is where you're traveling. Air travel, if you stay masked, relatively safe. And then pick a vacation where you can be somewhat isolated with your bubble, with your family group. Don't do something that has you gathering in large numbers with people who are unmasked. We're just not quite to that point yet, but there are things you can do to enjoy yourself.
Dr. Jeff Pothof is with UW Health. We're speaking about where we are in the pandemic. Doc, if I can take you back like a year again, because we've been kind of looking at this a year since the pandemic. Have you already, or at what point will you start looking back on the measures that we took to address this and really evaluate what did work? Was masks the right thing to do? Was quarantining the right thing to do? Safer at home? All of these things that we did to mitigate the spread. When will you, or have you already started looking back on what's worked?
For some of those big measures that have big implications, masking, distancing, things like that, we were doing the science as the pandemic unfolded, and we now know those things work. I think what you will see going forward is, should we probably not mandate masks during future flu seasons? What other additional therapeutics might come out? I think we'll better understand the therapeutics that are out there as we go forward in this next year.
Dr. Jeff Pothof of UW Health. Great to see you again, Doctor. Appreciate your insight as always. And for more updates on the vaccine rollout and coronavirus restrictions in your area, you can just head to tmj4.com/coronavirus.